Hi guys, we are proceeding to page 383 of Trailguide to the Body. We are continuing to feature all flexors of the ankle and foot. Okay, we're still at leg and foot. So Tom, Dick, and Harry. Okay, so uh, I know when I was at a therapy program, I heard about Tom, Dick, and Harry, and like, what is that? So it is a mnemonic device that corresponds to the initial of the tendons and vessels in the order that they pass by the medial malleolus. Okay, so tibialis posterior is the most anterior. Okay, followed by flexor digitorum and tibial artery, tibial nerve, and then flexor hallucis. Okay, so looking at here, we have the medial view of the right ankle. We have the medial malleolus here. We have the tibial posterior. We have flexor digitorum longus. We have tibial artery, tibial nerve, and flexor hallucis longus. Okay, so looking at page 7.95, whereas the partner is showing a middle view of the right leg, and the client is in a supine position. Partner wiggling his toe. Okay, so as you can see, the client is trying to locate the flexors. Okay, uh, it's wiggling the toe, but the client is supporting that, and the therapist thumb is trying to feel for the flexor digitorum longus, tibialis posterior, more so later, because ideally you should be trying to palpate or strum along, right? And then we have here the calcaneal tendon. Okay, this is where the gastric and soleus are um, transitioning into tendon, the calcaneal tendon, and then flexor hallucis longus tendon. These are the tendons as well. Flexor retinaculum, it goes under, and then medial malleolus, tibialis posterior again. So all the flexors, so having your partner in supine, prone or side lying, actually they will all work. So locate the medial malleolus. Okay, so slide off the malleolus posteriorly and proximately into the space between the posterior shaft of the tibia and the calcaneal tendon. Explore this region for the distal bellies and tendons of these muscles. So you're going to follow the tendons distally around the back of the medial malleolus. Okay, so it is difficult to isolate specific tendons. However, tibialis posterior will be the most anterior. So have your partner invert his foot as you follow this tendon around the ankle to the underside of the foot. Okay, so ask yourself these questions to confirm. Again, we need to be making sure that we are on the proper landmarking. Okay, so place your fingers on the distal bellies and ask your partner to slowly wiggle all his toes. Can you feel the muscles or tendon shift? Can you locate the medial malleolar groove and feel the tendons in and posterior to it? Can you also locate the pulse of the tibial artery? Again, we need to be making sure that we're not compressing on the artery, the nerve, or even the vein, right? Or even the lymph nodes, right? That's why when we do the manual lymphatic drainage, MLD, it has to be really, really as if you're not really touching. It's just pushing it very, very slightly, right? But I'll see you guys on page 384